Welcome to Kine 610 Evidence-Based Practice. The topic for today's online lecture will be critical appraisal. For the purpose of this online lecture, we will focus on the critical appraisal process as it relates to the research literature. However, clinical expertise or clinician expertise is also considered a viable source, and information you receive from a fellow colleague or clinician should also be appraised and considered when making an informed clinical decision or when trying to answer a clinical question, right? And so what is critical appraisal? Critical appraisal, as we've already discussed in the module, is the process of carefully and systematically examining the research to judge its trustworthiness, right? As well as its value and relevance in a particular context. And so critical appraisal will also allow you to determine whether the research articles you are reading or using within your capstone or thesis project can be translated and applied to help you answer your overall clinical question, and more importantly, whether or not those findings of the studies can be applied to your clinical practice to hopefully improve either patient outcomes or clinical outcomes in your clinical practice. And so throughout the critical appraisal process, there are several questions that you want to consider that will help you determine whether the results of the research study you are reading is valid. And these questions will be the focus of this lecture today. So I'm Dr. Cosby. I look forward to facilitating this online lecture. Throughout the critical appraisal process, there are several questions you should consider to help you determine whether the information will be useful for your patient case or clinical practice setting. So essentially, you should be able to basically answer three general questions for each research study that you are reviewing at a minimum. And stop number one, the first question is, are the results of the study valid? So as you are critically appraising a research study to help answer a clinical question that you may have, it is crucial to determine whether the results of the study are valid, right? And so more specifically, you will need to determine whether the findings produce answers to what the researcher was initially examining. Ideally, the primary purpose of conducting research is to use systematic approaches to find answers to clinical questions, right? And so that's kind of what you're doing with your capstone projects or your master's thesis projects. You are asking a clinical question. You're going to conduct some form of research study to hopefully help answer that clinical questions, right? And so although most researchers' intentions are to find such answers, there are several factors that can kind of influence the findings of the study and therefore affect the validity of the study. And so that's why we have to read research articles with the critical eye. So as you finished up research methods and you've proposed basically the methods for either your capstone or your master's thesis, one of the things that you've done over this entire first quad was you really tried to control for threats to the internal validity of the study, right? And so we think about validity, what we say is that there are two different types of validity, right? There's internal validity and then there's external validity. Internal validity would be how well the study was conducted. And then there's external validity, which is how generalizable are your results to the entire human population, right? And so one of the things that we do as researchers is we really try to increase the strength of the internal validity by controlling for factors that might introduce either bias and or error. And by increasing the strength of our internal validity, we may sometimes decrease the external validity, which means that the results may not be as generalizable to the human population, right? So it's important that as you're reading these research articles and you're using them to help drive clinical decisions, that you truly make sure that the results of the study are valid and that they have, a very strong internal validity and high in external validity so that your results can be generalizable to a specific subset or population. So along with assessing the validity of the study, the other question that you have to ask is, are the results of the study reliable, right? And so the reliability has to be considered as you're reading your research articles and as you're deciding whether or not the results can be applied to your clinical practice. More specifically, it is important to determine whether the findings of that research study can be reproduced if the same study was conducted again, right? And so a lot of you guys are doing a small project for your capstone, or you're doing a more larger scale research project for your master's thesis. And I'm assuming that you have based your research study on either a previous research study that you've read or that's been conducted. And some of those methods you are borrowing from a research article that you read, right? And so part of your ability to reproduce those methods is based on the idea that the results or the methods used in that particular study were highly reliable. So in addition to the reliability of the results, it is also necessary to appraise the reliability of the tools and the equipments that were being used to collect the data. So when we look at reliability, how reliable are the results? How reliable are the methods? And how reliable are the tools that were used to either collect the data on the subjects? So we really have asked two questions. Number one, are the results of the study valid? Number two, are the results of the study reliable? And one of the last questions that you should be asking yourself as you read the study or as you finish reading the study is whether or not the findings or the results of those studies are clinically relevant, but not only just relevant, but applicable to your PICO or the clinical question that you are trying to ask. As is human nature, no single research study is perfect, right? We wish that they were, but the odds of us finding one research study that was conducted without bias or without threats is relatively rare. So being able to identify flaws, limitations, and threats to validity will not necessarily eliminate the study from consideration, but will aid you in making a more thorough clinical decision, right? So it's in retrospect, what we could say is that it's easier to identify aspects of a research study that were poorly conducted versus highlighting or finding the positive parts that were performed correctly. And so when we think about this process of critical appraisal, yes, we want to know that the results are valid. Yes, we want to know that the results are reliable and that the tools being used to collect the data were reliable as well. But what we also need to know, and what's really important, is whether or not those findings are clinically relevant and whether or not we can use those results to shape or inform our clinical practice. So as you begin to formulate or as you begin to critically appraise the literature, it becomes way important for you to find a process that will work best as you dive through and as you're looking through research articles with a critical eye. So what I want to provide you with is a real life sample of the process of critical appraisal. And so what I'm going to do is basically provide you with a list of guiding questions that will help navigate you through the critical appraisal process. And I will be using a research article to drive the rest of this online lecture. So I hope this is helpful, as it is a clinical application. So the research article that I'm going to be using is the efficacy of combined cryotherapy or icing and compression compared with cryotherapy alone following an anterior cruciate ligament reconstruction. And so here are the authors of the study if you want to actually look it up. And so the first question that you would ask is, why was the study performed? What was the guiding clinical question? So this is one aspect that you're looking for. Did the authors report why they were doing this study? And can you guess, or can you kind of conclude what the clinical question was based on the purpose? And so if we look at one of the paragraphs in the introduction of this particular research article, what you'll find in the highlighted section is that the authors do a really good job of stating why the study was performed. The purpose of the study was to evaluate and compare the effectiveness of cryotherapy with or without intermittent pneumatic compression after arthroscopic anterior cruciate ligament reconstruction, with focus on post-operative edema, pain, and patient-reported outcomes, right? And so we could say, okay, why was the study performed? That answers that piece of the question. And then the other question is, what was the guiding clinical question? Well, we could kind of guesstimate that maybe the clinical question had something to do with, is ice a more effective treatment than cryotherapy and ice in reducing either edema, pain or self-reported function in patients with ACLs, right? They gave us enough information to create a clinical question. So as we begin the process of critical appraisal, the first stop in critically appraising a research article is to look for the purpose statement within the research article. You will find in lower quality articles, your case series, your case studies, that they may not present you with a purpose statement, right? And so that would make that research article probably lower on the critical appraisal charts. So the next question that you want to ask yourself as you're critically appraising is, what study design was utilized, and is that study design appropriate to answer that clinical question? And traditionally speaking, you can find the answer to the study design in the methods section of most research articles. And so it's very clear that in this particular research article, a prospective randomized control trial was used to collect data on these patients post-operatively. And is it the appropriate study design to answer this particular clinical question? And the answer is yes, a randomized control trial with two groups, one group that receives ice and one group that receives the ice and the compression. The next question, as you're critically appraising or reading this article, is, do they report how the sample size was determined? You'll remember from research methods that sample size is an important indicator of power of the study. And so a lot of research journals are now requiring most research articles to report how they calculated the sample size. And you can traditionally find this in the methods section under statistical analysis. And so this article, again, reports sample size beautifully, right? Our power analysis was performed to recognize a visual analog scale change of 10 millimeters out of 100 millimeters as recommended, 16 patients per group. So they use the outcome measure of the VAS scale to determine how many patients per group they needed to properly power this particular study, right? So they need 16 patients in the treatment group and they need 16 patients in the control group. And then this also makes it very clear that this is probably their number one or primary outcome measure. Okay, so as we begin this process of critical appraisal, we've said we need to know why the study was performed or what the purpose was. We need to know the study design, and then we need to know whether or not the authors actually calculated sample size, because sample size will help us determine whether or not this study was adequately powered, right? As we continue to assess our research article, the next question that we want to ask in the process of critical appraisal is, were the measurements that were used valid, and were they reliable, right? And so what we can say is that the authors report their measurements. Post-operative follow-up appointments were scheduled at, so measurement times, 1 week, 2 week, and 6 weeks post-operatively. And here's what they did at those different follow-up periods: the visual analog scale for pain, the short form 36 for self-reported function, right? And then also they had the patients take a diary. What I know about the VAS and the short form is that they are highly valid self-reported function tools to use to assess post-operatively. So we could say that yes, the measurements are highly reliable and valid. One thing that would make this research article a little bit stronger is to actually report what the reliability measurements are for each of the outcome measures. So the reliability for the VAS is, a 0.8. The reliability for the short form 36 is a 0.2, right? Which means this form probably isn't as reliable as the visual analog scale in assessing pain in patients post-operatively. So that could be one thing that would, if I were critically appraising, that I would ask the researchers to report prior to publishing this particular manuscript. Okay, so number 5, how was the data analyzed? And so there's two different things that we want to look at. We want to look in the statistical analysis section. Number 1, we have the power analysis, right? How did we determine the size of the groups? And then when we go down one section lower, what we see is what statistical analysis did they use? Well, they used a general linear mixed, or a GLM, repeated measures, ANOVA, and also t-test, right? And so it's clear what they used. And then what is also clear is what follow-up or post-test they used if they found, let's say, significance. One thing that isn't clear is which statistical package they used. Was it SPSS or was it a different statistical package? That becomes important when you're running statistics, because different statistic packages might yield different results. And so that would be one thing, if I were reviewing this article, that I would suggest the authors of this manuscript report as well. So number 6, were there any problems during the study? And I call this the limitations section. And as you are becoming researchers, you'll find that you don't want your limitations section to be way too long, right? Because then that kind of puts up a red flag and makes the reviewers think that there was too much bias in your study. And so, were there any problems during the study? Yes. Patient blinding was also not possible. So patients were not blinded to treatment. And so because of that, the authors say there probably was some bias associated some bias in the study. Another limitation to the study is that preoperative VAS score between groups was not anticipated and represents a potential source of bias. So what this means is that the two groups were different at baseline, so that it becomes an issue. And then one of the bigger issues you'll see down here on the bottom, we also cannot explain the absence of a difference in circumferential measurements. And so they can't explain one of the results that they got, right? I believe that to be an issue as well. So as we're critically appraising this research articles and we're looking at the limitations that exist. Okay, patient blinding, you can't blind a patient. If ice is a treatment, there's no way that they can be blinded because they'll feel the cold or they won't feel the cold. So I don't consider that to be a huge scientific flaw. But what I do consider to be a huge scientific flaw is this idea that there were differences between the groups before they even began the treatment. So you'll have to account for that in your statistical analysis. Moving forward, what we want to know is, was previous research performed in this area before? And if so, how do the results compare? And so you can imagine that we're actually going to go into the actual conclusions section, and that's where the authors hopefully are going to compare and contrast their results, right, with previous results. And so here's a prime example of that. The addition of compression appears to contribute additional benefits with traumatic soft tissue injuries and in the post-surgical patient, and it results in local reductions in blood flow and edema that are superior to extremity elevation alone. And you can see that they are referencing previous research, right? In their study of patients undergoing ACL reconstruction, Schroeder and Passler substantiated these claims. So they're reporting older literature and they're saying that this group of authors support the research findings in this particular study. So this is awesome. They're tying their results to previous literature, and it appears that their results are consistent with the previous literature. And then last but not least is, how does this research influence clinical practice? Can the results from the study be applied to my patient case or population, right? So that goes back to the clinical applicability of the study. And so in the end, the authors summarize by saying the use of cryocuff systems may improve short-term outcomes through reduction of narcotic pain medication use and enhancement of perioperative pain control. So what they're saying is that in the short term, ICE is a good clinical tool to use in patients post-operatively who've had ACL reconstruction, but they don't know anything about the long-term effects. So, 1 week of treatment with ICE there's a significant reduction in pain, and more importantly, there's a significant reduction in the amount of pain medication being used in post-op ACL patients. So you can see that as we're going through this process, right? Why was the study performed? What was the study designed? How was the sample size determined? This is almost like a checklist approach to assessing the rigors, the quality of the research article that you're reading. And as you do this time and time again, it will become an innate thing that you no longer have to write down, that as you're reading the method, you'll be looking for whether or not they reported their power analysis, whether or not they reported their statistical design, whether or not they reported their independent and dependent variables. But these all become a part of the critical appraisal process. So as we begin to conclude this online lecture, I just want to leave you with a few conclusions. Number one, you must take into account the characteristics of each study design when you are critically appraising. Remember that each type of design has its own advantages as well as disadvantages, and so it's going to be important for you to be able to recognize both. Therefore, to begin the critical appraisal process, it is necessary for you to determine whether the type of study design utilized to answer the clinical question is appropriate and well implemented, right? And so that's why we start with the first question. What is the study design that was utilized, and can that study design be used to answer the clinical question? Point number two, critical appraisal will become a natural part of your daily clinical decision making. Right? So that's like similar to many of the skills that you learn as an athletic trainer, a physical therapist, cardiac rehabilitationist, whatever your vocation is, right? With time and practice, your skills become better, and just that applies to critical appraisal, right? In that with time and practice, your skills for critically appraising the literature will become a natural part of your daily clinical decision making, believe it or not. Scary to think, but soon enough you will pick up a research article and you will never look at that research article with the same lens ever again, hopefully after this online lecture. Point number three, clinical expertise is important, but it should also be critically appraised. So what do I mean by that? The years of clinical experience that you all have in our Masters of Science in Kinesiology is tremendous, right? And we would never ever want to throw out anecdotal evidence or clinical prowess or expertise just because one research article that we critically appraised said something negative about what we've been doing in our clinical practice. But also, if we have colleagues or friends who give us information that may be good at improving clinical outcomes, that we should also critically appraise that as well. And the process is still going to be the same. You're going to look at that information with a critical lens. And then last but not least, I'll leave you with this point. Critical appraisal, it seems complex and daunting at first, but I promise you that once you begin to do this with at least maybe 10 to 15 research articles, that the next article you pick up, you won't even think of it as critical appraisal. You'll really just think of it as, this is what I'm supposed to do if I really truly want to change my clinical practice, if I truly want to be an evidence-based practitioner. This is the way that I should look at all research, with this critical lens. So thank you for your time. Looking forward to going through the rest of the modules in this course.